Welcome to Desert Living, where we connect you with everything that makes the Coachella Valley a wonderful place to live. Desert Living starts now.
Well, back again. I have Dr. Raj Sinha of Star Orthopedics. Today we're going to talk about something pretty important, hip replacements. How are you?
I'm great. How are you?
I'm doing well, thank you. Welcome back to the show.
Thanks for having me.
Yeah. So this procedure is coined or titled Operation of the Century. Is that true?
That's true. It got that term for the 20th century.
Okay.
And I think a very good reason for it. It's probably the first joint replacement operation that was properly studied and developed to the point where it was very reliable in allowing people to get back to very high quality and levels of function. Mm-hmm. If you think about it, the hip is right in the center of your body.
Yeah.
So when you have severe hip arthritis, you lose flexibility, you lose rotation. It affects almost everything you do. You can't even sit properly because you can't flex the hip up all the way. You have trouble lying down because you can't straighten the hip out all the way. So no matter what position you're in, it's very painful. Going to the bathroom is difficult. Sitting in a restaurant, sitting in a movie theater, all those things become very painful because of the loss of function. So to be able to cure that problem with an operation was a big deal.
Right.
And like I said, it was the first one done, and that's how it got the term.
So the difference between this and other procedures is just being is painful.
Just being, rest pain, night pain, people get really debilitated.
So speaking of advances in medicine, tell me about some other recent advances.
Well, there's been, I think, basically two areas in which hip replacement has advanced in the last decade and a half. One has been on the material side.
Okay.
The other has been on the surgical technique side. So about 15 years ago, we started hearing from patients that, the operation is great and eventually I get really good function. But that first couple months is killer. What can you do to make that better? So we started working on things like pain management and using nerve blocks to give people less pain immediately after surgery. We used smaller surgical incisions, less tissue destruction and dissection, the so-called minimally invasive surgical approach. And so now we still do that, and there are 2 or 3 ways to get into the hip. All 3 of them have been shown to be pretty equivalent, whether you do something called the anterior approach, whether you do a posterior approach, or whether you do something called a direct lateral approach. That's just the surgical approach. As long as you handle the tissues properly and do a nice, good pain management protocol, people will recover very quickly, much better than they did a decade and a half ago.
Right. The advances of medicine, there it is.
That's right.
So, do patients have any limitations? Can you elaborate on that?
Yeah, the biggest issue initially is just stability of the joint, because obviously when you're doing surgery, you're removing tissue and taking bone and cartilage out. So when you do the artificial hip, the patients have to be careful for the first month or so. Once you get past that first month and you don't have the hip pop out of joint, then the tissues become nice and stable around there. And then after that, they can very easily get back into most activities that they want to get into. I just saw a patient this week, as a matter of fact, who I did a hip replacement on, and he went back to competing in championship powerlifting. So,
geez.
Yeah, so obviously a lot of that has to do with him.
Yeah,
He's a pretty amazing guy.
But
the fact that we replaced his hip and got him pain-free, and then he rehabilitated it very aggressively, and he got back to doing what he loved to do.
So can you give me another example as far as what the future holds for a lot of these patients?
Well, I think that there's a couple of areas that we're working on. We still continue to evolve the surgical technique. Sort of the dream of a lot of surgeons is we do an operation on the operating room table. The patient literally walks off the table and walks to the recovery room. And that's, again, more this issue of minimally invasive and how do we get components that we design that we can actually put in through smaller incisions and these sort of keyhole incisions. That's one area that's being worked on. And the other area is biological medicine. We keep coming up with ways, we hope, to avoid having to replace parts and actually get them to heal and regenerate. And that's this whole area of regenerative medicine that a lot of universities are spending a lot of time researching and creating entire departments to focus on that.
That's a proactive approach.
I think it is. It takes a long time because obviously the human mechanism evolved over a long period of time, and it's very complex. And for us to think we can understand all of it would be extremely naive and or arrogant.
Right.
But we're getting there. We're learning more and more every day.
Right. I think the idea of our bodies healing themselves, which might be true to some degree, introduced with this, there's got to be a real big light at the end of the tunnel on this.
Well, I think it's very exciting for researchers in that area. There's no doubt about that.
Yeah,
and whether it's surgical technique or regenerative medicine, the sky's the limit.
Yeah, yeah, literally. My last question for you, can you tell me about some common misconceptions regarding this procedure, this specific hip replacement?
Well, I think the most common thing I hear from patients is, I'm in severe and debilitating pain, but I'm afraid to have the operation because of the pain of the surgery. And I have to explain to them the pain that you're feeling now from the arthritis, the constant pain that you have, is going to be gone almost instantaneously.
Right.
Yes, you'll have some surgical pain, but A, we can treat that, and B, that goes away. So don't be fearful of the operation. The risks, other risks that people are afraid of, like blood clots and infection, they occur.
That comes with any surgery,
They
right?
do, but the incidence is now less than 1%. So there really is no reason to be afraid of the operation if you need it.
Yeah, I'm glad you touched on that the pain you're already in, once you're out of surgery, most of that pain is already gone. And now it's just in this process of healing.
And hip replacement patients are amazing that way because they say, I feel better, minutes after they come out of their anesthesia, I feel better than I felt the last 10 years.
I've heard several stories about people with hip replacement surgery who literally, as you mentioned, they bounce back, literally. I mean, they're probably more active than they have ever been in their adult life. Pretty fascinating, Doc. Absolutely. Hope I don't have to call you anytime soon.
I hope so too for you.
Dr. Sinha's office is located in Rancho Mirage. You can check out Star Orthopaedic's website, palmsprings.kneesurgeon.com, or give them a call. Big thanks to Raj Sinha for being here, and thank you for being here as well. We'll see you after the break.
If you have an idea for the show, we'd love to hear it. Email us at desertliving@kmir.com for complete details.